Okay, today's topic is diet in diabetes mellitus. It's chapter 19, page number 399. Chapter 19, page number 399. Those who are joining late, just please help them out. Okay, starting with diabetes, the role of insulin is quite important here. So your pancreas will secrete insulin as well as glucagon, okay, two hormones that your pancreas would secrete in a healthy secretion of insulin. Whatever insulin the pancreas is secreting into the bloodstream, that the cells, your body tissues, your body cells will have insulin receptors on them, and as soon as the glucose is released as soon as the insulin is released, these insulin receptor cells, receptors on the cells will accept the insulin, and they will take up the glucose. So the blood glucose level will go down. Okay. Because as soon as the bloodstream which has high amount of glucose, after the secretion of insulin, it will enable the cells to take up maximum glucose so that they get the energy. Okay, so that automatically from the blood, the glucose will be transferred into the cells where it will be used up for energy, and the blood glucose level will come down. This is the normal mechanism that happens in a healthy human body. Okay, in diabetes we have two types, type 1 diabetes and type 2. So in type 1, it's kind of an autoimmune disorder that usually it will manifest during a person's childhood itself. So that is why it also has a name called as juvenile diabetes. Okay, it's an autoimmune disease in which the pancreas, they don't even produce insulin. Okay, the beta cells of the pancreas which are supposed to produce insulin, they get affected, they get damaged. Okay, so that will lead to pancreas not producing enough insulin. Okay, so that will lead to increased blood glucose level, because there is nothing that will enable the cells to identify glucose and allow the glucose to come in. Okay, so the glucose will stay in the bloodstream, and it will lead to a lot of increasing glucose levels. Then type 2 diabetes, which is quite common in adults. Okay, those who are obese and who, it's a lifestyle disease. Usually when we talk about type 2 diabetes mellitus, it's a lifestyle disease. Okay, so in this condition, your pancreas can produce enough insulin, but the insulin receptors of the cells, they do not respond to this insulin. Okay, they don't know what it is, and they completely shut down insulin. Okay, they don't allow insulin to come and tell them to open the doors so the glucose can come in. Okay, it won't happen. So the insulin is already been secreted in the bloodstream, but the cells, the receptors, insulin receptors on the cells will not work, and what happens is the cells will not take up glucose. So glucose will stay in the bloodstream, and it will lead to hyperglycemia, increased blood glucose levels in the blood. Okay, so this is what happens. This is the normal mechanism of a typical condition of diabetes mellitus, type 1, type 2. Okay, and in some case there are three types of mechanism of action. One is the pancreas won't produce insulin. The second kind is they produce insulin, but the cell receptors, they do not identify insulin. And the second thing is, even if the cell receptors identify insulin doesn't have the capacity to work. It is action deficient. Okay, these are the three major mechanisms. In different levels, it may start in different individuals. Okay, so type 1, and this is the basic anatomy of pancreas. If you take a view of a pancreatic cell composition, you have alpha cells and beta cells. So beta cells from the islets of Langerhans. Okay, beta cells will release insulin, alpha cells will release glucagon. Okay, insulin will bring down the blood sugar levels, and glucagon will lead to increased blood. It will enable, glucagon will enable your liver. Okay, it will go and enable your liver to give out the stores of glucose back into the bloodstream. So that's how glucagon works. Insulin has just the opposite function. Okay, it will make sure that the blood glucose from the blood is taken up by various cells like liver cells, your body tissue cells, wherever energy is required. Okay, so they are antagonist to each other. Okay, with respect to the action they play in a human body, they are kind of antagonist to each other. Okay, they cut each other's action out. Okay, so the prevalence of diabetes in India, 61.3 million people in India, they live with diabetes. And type 1 diabetes commonly found among children. Even if the children have any other kind of autoimmune disorders, sometimes, yeah, both are kind of less in the same ratio. You can see a histopathology. Okay, just search about the histopathology of alpha cells and beta cells, or histopathology of islets of Langerhans. Okay, just search about it. You will see the image. Okay, I have mentioned it in the chat box. Just search about it, histopathology of islets of Langerhans. You will find what is the composition of alpha cells and beta cells. Yeah, if the glucagon increases, automatically more and more glucose will be secreted out into the bloodstream. Okay, with the increase of glucagon, there will be increased risk of hyperglycemia. Okay, and with if glucagon is not produced by the alpha cells, what happens is too much of insulin will be running in the bloodstream, and that will lead to hypoglycemia. Both these conditions are very dangerous. Okay, your blood sugar levels dropping down abnormally and rising too high abnormally, both are dangerous. Okay, they have high mortality risk, both these conditions. Okay, so a brief about type 1 and type 2 diabetes. Type 1 occurs when the pancreas are unable to produce insulin, okay, and it develops at a very young age. It cannot be prevented. For lifelong, these children throughout their adolescence, throughout their adulthood, into the mid age to the old age, they will be completely dependent on insulin. Okay, hyperglycemia symptoms is you will feel fatigue, and you will lose your consciousness, you will feel dizzy and all. Okay, and immediately you can give them glucose. Okay, if glucose is not available, 1 teaspoon of sugar into their just put it into their mouth, it will be easily absorbed. That's the first emergency step which we take. If they feel just by having glucose water, some people may feel nausea. Okay, in that case you can give lime for hypoglycemia, not for hyperglycemia. This is what we have to do for hypoglycemia. In case of hyperglycemia, your heart palpitations will increase. Okay, you will feel like what to say, you will sweat a lot. Okay, there will be a different people have different kind of signs and symptoms of hyperglycemia, but usually they sweat a lot, their heart palpitations will be very high. Okay, it's like the heart will be thumping on their chest. Okay, they will complain of that issues. Tremors will be there, tremors, their hands will, the extremities and their hands will shake a little bit. Okay, they will feel very cold, like they will feel like it is chilly around them. Okay, that's the kind of symptoms which we can see even in hypoglycemia. Okay, in hypoglycemia, set will not be, sweat will not be there, but they will feel very dry, they will feel chilly, and they will feel dizziness. Okay, so that's the classical signs and symptoms. But still, a random blood sugar, that the immediate one which you can, like the AccuCheck which you use at home and all, that you can use to immediately identify what's going on. So type 1 diabetes, insulin therapy will be started at a very young age. Diet moderation is also there, but like since it happens in a very young age, a child's nutritional requirement should not be masked with the diabetes diet. Okay, the child requires to please wait for this class to get over. Please don't ask too much questions in center in between. Okay, it will be quite distracting. You will get all the answers throughout the class. Please wait for it. Yeah. So insulin therapy, the children will be on insulin therapy since their childhood, but the diabetic diet which you give to these children who are suffering from type 1 diabetes, they should this diet should not mask the nutritional requirement which a child may require during their growth and development. So what it means is that you will be giving them enough diet. It will have high carbohydrate diet, okay, but complex carbohydrate diet will be given to these children. Simple sugars will be avoided. Rest all the areas like proteins, fat, calcium, vitamins, minerals, everything will be as a normal growing child. Okay, what you will give to a healthy child, the same diet you have to plan for type 1 diabetes children, because their growth and development should not be deficient. But the insulin therapy which you give to children, it will be such that insulin, you will try to adjust the insulin therapy, but you will not try to do too much adjustment in the diet, because growth and development has to be achieved. Then coming to type 2 diabetes, occurs due to insulin resistance. The body cells, especially the body cells, they do not allow insulin to come and activate on their receptors. Okay, so when the insulin doesn't reach the insulin receptors, the cells won't have the energy to take up glucose from the bloodstream. So that's insulin resistance. It tends to develop at an older age because of various lifestyle choices. Okay, and it can be prevented. Autoimmune diseases cannot be prevented, but yeah, lifestyle diseases can be prevented. Can be managed by lifestyle modifications alone if it is diagnosed early. For example, not all diabetes require hypoglycemic drugs or insulin therapy. Diet alone can still, if somebody is in a pre-diabetic stage, diet alone can control their signs and symptoms if they are very focused about it. Okay, no need to start all the diabetic journey along with hypoglycemic drugs and insulin. With diet alone, you can try to manage your diabetes. So the signs and symptoms for these cases are similar. They have the same signs and symptom: frequent urination, thirst, extreme hunger, weight loss, fatigue. Okay, sometimes if it has if it is a later stage, it will turn into retinopathy, like blurred vision, cataract, retinopathy, neuropathy. Those things will start. These are the complications. Okay, numbness and tickling sensation of hands and feet, because it has neuropathy has started for this particular patient. With lifestyle modifications such as healthy diet, physical activity, regular blood sugar monitoring, etc., you can counteract the signs and symptoms. So for type 1 diabetes, what are the causes of, like, what leads to this type 1 diabetes? The first thing is genetics. It is this type 1 diabetes, it's autoimmune disorder. So usually it's inherited by the parents, like the child may inherited by the parents' gene. Then we have infections, early childhood, during their when they are in the mother's womb, during their infancy. Okay, all these stages, they have suffered any other form of autoimmune disorders or any other form of serious infections during these early stages. There are high chance that these children may counteract type 1 diabetes in their early childhood. Then acute stress, like if they have any inborn metabolism errors of metabolism, like fructose metabolic error and all. Okay, when the body is under that kind of stress of metabolic errors and all, they have a high chance of transgressing into type 1 diabetes. Okay, then we have immunological factor. Since it is an autoimmune disease, the immunity, the white blood cells, it will directly go and attack the islets of Langerhans in the pancreas, and that's how you get a type 1 diabetes. Then for type 2 diabetes, it's a lifestyle disorder, obesity, okay, having too much of high carb, simple sugar diet and all, and taking too much of refined sugars or refined flour, completely dependent on refined flours, etc. And calorie counting is not done, especially during the mid adulthood and at the start of late adulthood, and when there is no physical activity, sedentary lifestyle. So these are the causative areas, factors for lifestyle associated diabetes mellitus, that is type 2 diabetes. And then genetics also, the parents, if one's parents both the sides have diabetes, the child is also at the high risk of getting early diabetes, not the type 1, but in the mid 30s or mid 40s the child may get diabetes because both their parents were suffering from diabetes in the later stage. Okay. Then age, after the age of 40, 45 for men, and after the age of 50, after attaining menopause for women, okay, there are high chance of getting diabetes. And abdominal fat, you can see in the image given here. People who have a very high waist to hip ratio, okay. For example, the circumference of your waist is much higher than your hip. Okay, so like for example, if you have an apple kind of body shape, not the pear, but the apple kind of body shape, here you can see a man's apple kind of body shape, how it looks, and for a woman, how it looks. The abdominal area that has the high amount of fat. Normally, for every human, your abdomen is the area which stores high amount of fat. Okay, so when there are excessive adipose tissues and excessive fat storage, especially in this abdominal area, just by looking at their physical form, you can identify this person is at high risk of getting diabetes, or they may be already diabetic, they may be undiagnosed already diabetic. Okay, and women, and as well as not just for women, some men also do have pear shaped body where like their waist is quite less, but their hip size is comparatively more as compared to their waist size. Okay, so pear shape you can see both in women. It is quite predominantly observable in a woman's body as compared to men. Okay, but people who have a pear shaped body, they have lower risk of getting diabetes. Okay, people who have an apple shaped body, they have the highest risk of getting diabetes. It's because of the fat stores. Okay, when glucose is not converted into energy, what happens is that this glucose will be converted into fat, and it will be stored around the abdominal area. Abdominal area is the first place where, when you put on weight, usually for an apple shaped person, when you put on weight, usually it's your abdominal area which will try to enlarge first. Okay, later the hips, thighs, and upper body parts will try to put on the weight. But for apple shaped bodies, abdomen is the first place where fat deposit will start. So unutilized glucose, which is running in your bloodstream, if it is not utilized for energy purposes, it will be converted into fat. Okay, so that's how people who have a pot belly, they have highest risk of getting diabetes. And then we have insulin resistance. When we eat food, as soon as the food reaches, when the chewing starts, okay, at that time itself, the insulin secretion will start. And by the time the food reaches the stomach, insulin secretion has started. That's how the mechanism works for the GI system. Okay, so even when the insulin is been secreted out in the bloodstream, the cells won't respond to insulin. And if the cells won't respond to insulin, they will not take up the sugar. And if free sugars are running in your bloodstream, it will be converted into fat. So this is the vicious cycle of insulin resistance, because you feel very tired even after having food. You feel tired. The reason is you had food to supply energy to your cells. Okay, but the cells, being insulin resistant, they will not take up the glucose for energy. Okay, so cells do not have energy, and on a larger level, it will be shown up as the person has fatigue and is usually tired. Okay, so your body will obviously you're putting food into your stomach, but it is not been utilized for energy. It has been utilized to store as fat. So symptoms of diabetes mellitus. First is hyperglycemia, when insulin is not produced and it is ineffective. Increased glucose levels will be there in the blood circulation. That's how we see hyperglycemia. Whenever you take a random blood sugar test for these people, usually the blood it will be around more than 160 or nearing 200. So it means the person is diabetic. Then we have glycosuria. Kidney automatically has this innate responsibility, like when the blood, this glucose-rich blood, okay, unutilized glucose-rich blood reaches the kidney. It signals the kidney that something is off. There is too much of glucose here. Let's put all this glucose out through via urine. Okay, so that's your kidney's mechanism to protect your body. So that's how you get glycosuria. Too much of glucose will be secreted out in the urine. Why? Because there is too much of glucose in the system. So kidney is trying to filter the maximum glucose out of the body to bring that homeostasis into your system again. Okay, so that's how you get glycosuria. Then again, when the kidneys are busy in taking up the taking up the glucose, along with the glucose excretion, lots of essential electrolyte will also be excreted. The kidneys will fail to detect that, okay, because they will be the kidneys are busy filtering out the glucose. Along with too much of excretion of glucose, a high amount of essential electrolytes like sodium, potassium, magnesium, all these things will be excreted out along with glucose. So there will be a fluid electrolyte imbalance in the body. So the body will go into the state of acidosis because there is an insulin deficiency, and the utilization of fat, it also decreases. Okay, so this will make sure that your blood turns, your body turns quite acidic. You will have a lot of free H plus ion, hydrogen ions running around in the body. So body goes into the state of acidosis. Polyuria and nocturia, too much of urination, frequency of urination will be quite high, and even at night, usually like at least once a night, if you're getting up for urination, that's fine, that's quite healthy. But more than 2 times at night, if you're getting up you wake up just because of the urgency to urinate, okay, that's what we call it as nocturia. Okay, frequency of increased urination at night. Okay, polyuria and nocturia. Then polydipsia. Polydipsia means increased thirst. Okay, because since such a lot of fluid is being lost from the body, with regards to polyuria and nocturia, your body is sweating a lot and it is putting out a lot of fluids. It is excreting. Automatically, your thirst mechanism will be heightened. Okay, it's your body's signal to replenish it back with the fluid that it has lost. While taking out the glucose from the body is losing a lot of water. So the thirst mechanism will be heightened. So that's why, along with polyuria, there is an increased fluid output, but the body requires the same amount of fluid to be replenished. So that's why you get a vicious cycle of polyuria and polydipsia. Dipsia means increased thirst. And for polyphagia, since your cells want energy, but because they are resistant to they are innately resistant to insulin, they can't take up glucose for energy, but they require energy. And in general, your body requires energy, but the food which you're giving, because of the insulin resistance, they can't take up that food for energy. So your body will consciously be in a state of hunger. Okay, you will be extremely hungry. How much ever you eat, it will not be satisfied because it is not fulfilling the energy requirement for your body. So polyphagia. Okay, too much hunger. You want to continuously eat all the time. So frequency and the quantity and the amount. Okay, that will be quite high. Okay, you will not know when to stop eating. Satiety levels will be will be altered. You will not know when to stop. Okay, then dehydration. Because of too much of loss of fluid, the body goes into the state of dehydration. Fatigue and weight loss. A lot of water weight will be lost, so that will also be aiding to the weight loss. And fatigue, because energy requirement are not fulfilled. So an increased excretion of potassium, magnesium, phosphorus. When there is a excretion, too much excretion of fluid from the body, automatically all these electrolytes will also be flushed out of the body. So that's why you get all these signs and symptoms in diabetes. Then diagnosis for glycosuria, we have Benedict's test. If you are living somewhere in a rural India, something like that, or if you have done nursing or you have done MBBS, community health, community medicine, community nursing and all, these students as well as nurses and doctors who are in the community health field, usually they go door to door taking this Benedict solution, and they will check the high risk patients for diabetes, because in rural India, most of the people who are diabetic, it goes undiagnosed because there is a lack of awareness. So Benedict's test is a test which we can do anywhere. Okay, just put a little bit of Benedict solution, equal amount of Benedict solution to the urine sample. Heat it up and you can see the color change. Okay, if it's the sample, urine sample stays blue, there is no glucose in the urine. Okay, if it is yellow green, okay, traces of sugar, orange moderate, and if it is brick red, the person is diabetic. Okay, pre-diabetic and diabetic. So this is the Benedict's test for checking glycosuria. Then ketonuria, ketone bodies will also be excreted from the through the urine. So again, ketone, we have some ketone test sticks. Okay, you have to dip this stick into the urine, and you can see the color will change within 15 seconds. And the bottle which has this ketone body test strips, that will have a reading attached to it. You can compare the reading. If it is negative, you are diabetic. If it is positive, you are non-diabetic. Okay, that's the bottle the reading which is coming along with the bottle. It will show in which scenario the patient is in currently. So that's the test for ketone bodies in the blood and urine. Then we have random blood sugar test, RBS test, any time of the day. Okay, randomly you can just use AccuCheck and all, whatever you use at home. Okay, AccuCheck can be used for this thing. And if the random blood sugar is more than 200 mg per deciliter, it means this person is diabetic. Okay. Then we have glucose tolerance test. For glucose tolerance test, 75 gram of glucose. Remember that, okay? 75 gram of glucose will be used. Before you give the patient 75 gram of glucose, you have to first collect their fasting blood sample. Okay, and the person has to be on fasting for at least 12 to 15 hours the day before. Okay, 12 to 15 hours of fasting has to be followed by this patient, and then they will go to the clinic. They will draw the fasting blood sample, and after that the patient will be given 75 grams of glucose. And some people, if they are feeling very nauseous by drinking glucose water, you can add some lemon to it, make it like a lime water, and give it to the patient. Exactly 75 gram has to be given, and over a period of 2 hours, every 30 minutes you will draw the blood and urine specimens. It has to be collected every 30 minutes for the next 2 hours, and you have to put the readings on a graph. Okay, at the end of the day you have to see and you at the end of the day, you like at the end of 2 hours, you have to plot the graph wherever you have plotted the readings, how much of a reading has been shown every 30 minutes. When you plot it on the graph, connect the dots and you will find the graph something like this. Okay, so here you can see a normal glucose tolerance test. During the fasting blood sugar, the blood glucose level was quite less, and as soon as you gave them 75 gram of glucose, there will be a spike in the blood glucose level, and slowly over a period of 2 hours, it will come back. The blood glucose level will come back to normal range. Okay, so that's this shows a person is healthy. Okay, but when there is an impaired glucose tolerance reaction, usually you will see this in a pre-diabetic case. They are not diabetic yet, but in a pre-diabetic case, you will see this kind of spike. There will be a spike initially. It will drop down, and again there will be a small spike. Okay, it goes like too many mountains or few mountains in this graph. That means there is an impaired. It is an impaired glucose tolerance test. Okay. Then coming to a person who has diabetes mellitus, for them the glucose tolerance test will look something like this. The red line which you can see, there is steep spike. Okay, as soon as they have this 75 gram of glucose, um, the level at which their blood sugar level will rise is quite high, and it will be very soon as compared to a normal healthy person. Their blood level, glucose level will spike very soon, too soon, very quickly, and it will be quite high. Okay, and then it will not come back to normal even after 2 hours. Even after 2.5 hours, their blood glucose level will not come back to normal. So it shows the person is diabetic. Okay, so this is the result of an impaired glucose tolerance. This is how it looks like. Okay, the first two lines, the blue one and the red one. The black one is of a normal person who is not diabetic. The blue one is of a pre-diabetic, and red one is the diagnosed case of diabetic mellitus. For Benedict test, you have to put the urine sample, and the Benedict solution has to be mixed. Okay, like 1 ml of Benedict solution and equal amount of urine or some drops of urine, and then you can heat it up in a bath. Okay, either you can directly heat it in the test tube holder, like with a direct flame, but it is ideal to use it like heat it using a boiling water in a water bath. That is the ideal way, so that you don't break the test tube. Okay, then you will observe the color change, and if there is no color change, means there is no glucose, no sugar traces in the urine. Okay, if there are slight traces, it will be green. Okay, and if if the color is brick red, orange or brick red, means the person is diabetic. That's about Benedict's test. But coming to the treatment of diabetic mellitus, in initial few stages of diabetic mellitus, or in a pre-diabetic case, diet alone can help the person to achieve a good lifestyle. Okay, diet alone along with some physical activity, etc. No need to directly jump onto hypoglycemic drugs. Depending on the case, depending on the stage of diabetes, the level of blood glucose levels in their urine and blood, this treatment management will be given by the endocrinologist. Okay, and then diet plus hypoglycemic drugs for some patients. This is also the initial few stages of diabetes, and then if it is it's a type 1 diabetes, or it's the blood glucose level and urine glucose levels are quite high, okay, more than 200, etc., for them insulin will has to be started. Okay, usually if it is more than 300, 350, insulin has to be given, no other way. So diet, hypoglycemic drugs, insulin, and all the people who come under the pre-diabetic and diabetic category, repeated urine testing has to be conducted on a monthly basis. Blood glucose monitoring on a daily basis is ideal, or at least on a weekly basis it has to be done. HbA1c test is very essential here. Okay, the diabetic profile of a person from the past 3 months can be seen by when you do an hemoglobin A1c test. Okay, so I'm putting it in the chat box. The diabetic profile for the past 3 months, we can see, we can identify a person if it is he or she is non-diabetic, pre-diabetic, or diabetic by using HbA1c test. It is much more reliable than doing your blood glucose monitoring on a daily basis, because sometimes there will be an error from the machinery side or a human point. Okay, errors can take place. So HbA1c test is quite ideal. Then this is the body weight management one has to achieve. If they are obese, overweight, this is the ideal body weight they have to achieve. So Broca's index and BMI, any one format we can use. Okay, so Broca's index is much more easier. Okay, so whatever is the height of a person in centimeters, minus 100 for men. In your textbook for women and men, both they have asked to minus 100. But in some sites, they say that if it is for women, a woman's height in centimeters, minus 100, 105. Whatever is the answer, that is your ideal body weight. For example, if a person, their height is around 162 centimeter, okay, 162 centimeter. If it's a man, minus 100 of 162, so it's the 62 kilograms. 62 kilograms is the ideal weight for this particular man, adult man, okay, whose height is 162. When it comes to a female with the same height, 162 centimeter, minus 105, so it's around 57 kilograms. So a woman of the same height, she should have 57 kilograms. For men, it should be 62 kilograms. The ideal weight should be around these two figures. So that's the Broca index. And then body mass index, BMI. I hope everyone knows the calculation of it. Your weight in kilograms divided by height in meters, like centimeters converted to meter, and square it. You have to divide the weight in kg by the square in meters. Whatever the answer is, you have the BMI chart. You just Google it, okay, BMI chart. If it is 24, 24.5, the answer is 24.5 or below that, they are normal weighted. If it is, if their BMI index is less than 19, 19 or less than 19, they're underweight. 25 and above, overweight. And if it is 30, about 30, obese. Okay, so you can find the BMI chart in the Google. Okay, any sources, usually all the sources have the same index values for BMI. You can follow that. So treatment should start with, ideally it should start with weight management. If the person is overweight or obese, weight management. Along with weight management, dietary management can be given, because if once the weight management, if you have a schedule of weight management, if you want to proceed with weight management, you can calculate how much kilocalories you can allow this person on a daily basis, and based on that kilocalories, you can make a menu plan for them. Okay, using various food exchange list, etc. Menu planning can be done. So ideally, go forward with diabetes, the diabetes patient, go forward with weight management and then lifestyle changes, etc. So food exchange list is key here. In your dietetics textbook on page number 24, 1.1 table, 1.11, table number 1.11. Am I audible now? Is my voice audible now? Okay. Those who have the textbook with them, please go to page number 24, dietetics textbook, page number, the same textbook, page number 24, table 1.11, the food exchange list which has been given there, table 1.11. So this is the food exchange list which you can use to plan for a diabetic patient, not just for diabetic, anyone you can plan this food exchange list. So it gives the amount of here we are looking at protein. Okay, the calculation of protein planning for a diet. So this is an example of how a food exchange list will work. Okay, so the quantity of the food is on the right side. Okay, how much, for example, if it is a big idli, okay, idli which is given, if the size of the idli is big, only one idli can give around 1.5 to 3.5 grams of protein. If it is a medium size idli, 1.5 idli can give you around 1.5 to 3.5 gram of protein. So like that, you have to use the food exchange list. Food exchange list is available online for carbohydrates, proteins, okay, fats, it's available. So please follow the food exchange list. Again, the repetition of this food exchange list chapter, menu planning chapter, will start from June first week onwards. Okay, so I'll retake this class. Those who have missed the class or new admissions, food exchange list will start. Okay. Diet and insulin, it is patient has to follow complete diabetic diet, and if insulin is required, no single dose of insulin should be missed during their management. Okay, then we have daphne. Daphne means dosage adjustment for normal eating. K means katori. Okay, katori. In that particular table, on 1.11 table, you will see a lot of examples which follows where K is following them. K here means katori, and one katori means 150 ml. According to your textbook, it is 150 ml. Okay, different site will say different values. If you search online, okay, different site will tell you different values for katoris. Some for some site it will be 200 ml, 150 ml, 170 ml, but in textbook it is 150 ml for a single katori. Okay. Am I audible now? Am I audible now? Is the voice clear? Okay, the K in that table, 1.11, page number 24, K means katori, okay, and one katori, according to your textbook, it is 150 ml. Different site will have different ml and different quantity for a katori, but for this particular textbook, with respect to the protein exchange list they have given, okay, K means 150 ml katori, okay. Then diet and insulin has to be followed. Then we have daphne. Daphne, it's the abbreviation which stands for dose adjustment for normal eating. So especially for people who are suffering from type 1 diabetes, the children and adolescents, etc. Okay, you can't restrict them too much on the diet because their normal growth and development has to be achieved. So as nutritionist, you should help them out with normal eating, normal balanced diet, what their peers may have. Okay, the same amount of carbohydrates, protein. But when it comes to carbohydrates, go for complex carbohydrates with low glycemic index. I'll show you the examples for that later. So that kind of diet plan you can give them, the same amount what their classmates, what their peers may have, the same amount, the same type of food can be given to them, but you will adjust the dose of the insulin so that it is not difficult for them to survive with such high blood glucose levels. Okay, insulin dose will be adjusted for their normal eating. So that's the use of daphne. So usually various organizations, they offer this course, and even for a patient who is newly diagnosed as type 1 diabetes, okay, from the hospital itself, they will train them, they will train the patient relatives, guardians, parents, okay, on what kind of meal plan they can have. Examples of food exchange list will be given to the guardians, okay, so that they can follow the same food meal pattern at home. And this using this daphne method, a person, a type 1 diabetes patient, can live a normal life as possible, and this life will be completely insulin dependent. But when it comes to the foods which they can incorporate in their diet, it will be very similar to what a normal healthy person should have. Okay, so that's definitely dose adjustment for normal eating. And even in some cases of diabetes where you do not have any other underlying diseases, for example, a person is classically suffering from only diabetes, their heart health is quite good, their kidney health is quite good, neurologically they are fine, okay, they do not have retinopathy or any eyesight related issues, okay, all the other systems of their body is quite good in respect to their functionality. They are only suffering from diabetes mellitus, in type 2 diabetes mellitus. Those people can also follow this Daphne method. Okay, they can also live a very normal life depending on a normal diet, but they can adjust the dose of the insulin therapy given to them. So next, nutritional requirement. When you come across a person with diabetes, ideally, even if they're sedentary, non-sedentary, or moderate working, ideally start with a 25 kilocalories diet, that is per kg body weight. And then carbohydrate, whatever their entire meal plan, like how much of energy their entire meal plan is going to give, only 45 to 60%. Okay, ideally just keep it just 50%, not more than 50%, but the range should not be above or beyond this particular range. 45 to 60% of the total calories should only have carbohydrates, okay, should come from carbohydrates. Others, high protein diet is a very good form of controlling the diabetes. Okay, high protein diet is a very good form, unless and until if they have any renal disorders, only then protein has to be restricted. Otherwise, if the diabetic mellitus is not accompanied with any renal diseases, high protein diet is quite ideal for them. Then proteins, high protein diet except in case of renal disorders. Then fat, 25 to 20 to 25 gram of visible fat. Okay, fat controlling you can do at home itself, okay, using your measuring spoons, etc. Fat measurement you can use. And for diabetic patient, it is 20 to 25 gram. For a healthy adult, it is around 35 gram of visible fat. So there is just a difference of 10 gram, just a 10 gram difference for a diabetic patient. So if you have a diabetic person in your home, just cook your meals on this particular range. Okay, cook your meals on 20 to 25 gram of visible fat. But while serving it to an adult healthy person, you can add a teaspoon of ghee or teaspoon of any virgin oil on top of that meal which you have prepared, and it will satisfy the requirements of the adult patient, and you don't have to do too much of modification for a diabetic person. Okay, so you can cook the meal on based with 25 gram of visible fat, and additionally add extra visible fat for those who require it. So less than 1200 kilocalories. Usually people who suffer from who are admitted in hospital with cardiovascular distresses or any renal distresses, okay, those who are admitted in hospital with this particular disorders, cardiovascular or renal disorders, usually 1000 to 1200 kilocalories diet will be given by hospital, and which has to be continued at home also. In most of the cases, 1200 kilocalories diet has to be continued at home also. So in that case, only specifically if the calories are this low, only in that case a person may require micronutrient supplementation. Otherwise, if a patient is on a 2000 kilocalories diet, all the micronutrient and macronutrient supplementation is not required. Okay, the food can give them the required vitamins, minerals, and micronutrient. But if they are strictly on such low calories, usually it will be for weight management, and if there is proteinuria or any other symptoms associated, to control that, a person will be put under such low calories per day diet. So in that case, micronutrient supplementation will be required. And soluble fibers, like insoluble fibers, you get it from your whole wheat whole cereals, pulses, and all. Soluble fibers are the ones which you get from raw fruits and vegetables. Okay, so 20 to 25 gram of raw fruits and vegetables. You can Google about how much servings. Usually, 2 servings of fruits and vegetables will give you 20 grams of soluble fibers. Okay, at least 20 grams of soluble fiber you will get it from raw 2 servings of fruits and vegetable, 2 cups or 1 cup. 1 cup. I'll show you the glycemic index which you can follow. It is coming up. Okay, just take a screenshot of that particular slide. So you will see which fruits you can give and how much cup of that fruit should be given. Okay, so that will satisfy the requirement of soluble fiber. And in some cases, usually when it comes to fruits, there are very quite few fruits which have very low glycemic index, which a diabetic patient can take. So that is the reason why anyone who is pre-diabetic or diagnosed as diabetic, they should have at least 25 gram of fenugreek seeds every day. That will give them satisfactory fiber levels. Okay, that is required for them. At least on top of the fruits and vegetables which you take, 25 grams of fenugreek seeds, soak it in water overnight, have that water in the morning, or use the powder of fenugreek seeds in buttermilk water or lime water. Okay, and have it just 15 minutes before you have your meal. You can follow this technique. A person who is suffering from diabetic mellitus should have at least 25 grams of fenugreek seeds, okay, by default on a daily basis. So it has this soluble fiber called galactomannan that will slow down the absorption of glucose in the intestine. It will delay the absorption of glucose. So it will keep the person satiated for a very long time. Okay, so that dysphagia, like frequent, like all the time they feel that they're hungry and they may munch on snacks and they may increase the blood glucose level, that can be avoided. Okay. So artificial sweetness, um, the brand name which is given on the right side, that would not be like all these brand names may not be available in Indian market. Okay, it is a mix of the brand names which are available in India as well as abroad. So all the brand names may not be, so don't worry about the brand name. Just search about the chemical composition of these artificial sweeteners. Okay, acesulfame, potassium aspartame, neotame, saccharin. Okay, stevia leaves, sucralose. These artificial sweeteners can be used. It is diabetic safe, but ideally it is encouraged not to take artificial sweeteners for diabetic patients. There is a reason why, because diabetic patients, once you are diabetic or you are pre-diabetic, you have to train yourself to wean yourself out of sweet diet and simple sugars. Okay, but if you are indulging in all the forms of diet with artificial sweetness, it will be difficult for one to wean themselves out of sweet foods. So that is the reason why don't encourage them to take the diet along with sweeteners. Okay, how much ever possible, try to avoid artificial sweeteners also. These are diabetic safe. They will be completely they get completely solute in the blood, and it will be taken out from the urine without affecting the system. Okay, there is no worry to it. But yeah, okay, some sweeteners, the old school sweeteners which you had, okay, which you used to get around 15 to 20 years ago, whatever sweeteners you used to get in the market, that was quite harmful for various systems. But nowadays there are quite new generation artificial sweeteners that are very healthy, and that are a very good choice for weight management and blood sugar tolerance. Okay, new generation artificial sweeteners like stevia and all. Okay, they are quite good and it is very safe. Okay, for people, especially, but for pregnant women we would recommend, because long-term studies of the effects of these sweeteners on reproductive health of women are not done. So because of a lack of research of the effects of these sweeteners on pregnant women, we do not know. So that is the reason why for pregnant and lactating mothers, we don't recommend artificial sweeteners. Okay. But for all the other cases, it is quite good, it is healthy, but the reason why we don't encourage diabetic patients to indulge in artificial sweetener is it is difficult for them to wean themselves out of sweet foods. Okay, if especially a person who has a sweet teeth, it is difficult. Yeah, jaggery and sugar has the same glycemic index. Okay, jaggery is not a healthy substitute to sugar. Okay, it may have extra nutritional benefits to it, like for example iron and minerals, but the way how sugar is going to spike your blood glucose level, the same way jaggery can also spike one's blood glucose level. Okay, so if you are targeting, if your target is to bring down your blood glucose level, neither sugar, neither jaggery nor honey, anything will work. Stevia will work. Okay, stevia is that sweet tulsi, mithi tulsi we say. Okay, stevia will work. Dried stevia leaves or stevia powder which is available, that works. Okay, that is a much more, and it's a very natural substitute to sugar. Okay, that's a very best option, next best option which you have, to get something natural, not synthetic, something natural, and still not spike your blood sugar levels. So stevia is a very good option. So glycemic index, low carbohydrate diet. Even as yesterday's class, for management of nephrotic syndrome and all, we have discussed that patients who have kidney disorders, they should be put on in some cases high carbohydrate diet is suggested. So this is where you plan a meal. Not all carbohydrates are bad. Okay, some carbohydrates are good in the sense they will not spike up your blood glucose level, okay, rapidly. They have very low glycemic index. Foods that have very low glycemic index, it will not spike your blood glucose level rapidly. It will just gradually increase your blood glucose level. Okay, so that so your natural insulin have enough and more time to tackle the blood glucose in the bloodstream and distribute it into the cells. So the foods that gradually increase your blood glucose level, those things are ideal. Okay, especially for people who are on high carb diet, complex carbohydrate diet with soluble fibers. Okay, that's the very best option which you can give to diabetes patient. Okay, so this is the difference. In this graph you can see how there will be a spike, there will be an increase in the blood glucose level over a period of time, while having a high glycemic index food and a low glycemic index food. So it's when you see this orange line and the area under the orange line, this orange line is very easy for your insulin to manipulate. Okay, your insulin can completely take care of this kind of spike without affecting any of your systems. But the red line, the red area and the red line which you see, that is quite tricky. Okay, that if you're on a high glycemic diet for high glycemic index diet for a very long time, that's how you develop insulin resistant. That's how you become insulin resistant. Okay, especially for people, for women who are suffering from PCODs or any reproductive health issues. Okay, any ovarian cyst or fibroids or PCODs, I would recommend all the students like who are dealing with these issues or who have people who are dealing with these issues, intermittent fasting. It's a very good idea here to make your insulin, make your cells to be away from insulin resistance. Okay, when you are suffering from PCOD or any other reproductive health for women, intermittent fasting is a very good option, because on a personal basis also we have seen this affecting. You will not require any hormonal therapy or any other therapy to bring your system back to normal, to bring your menstrual cycle back to normal with intermittent fasting. Okay. Am I audible now? Is my voice clear? Am I audible? Am I audible now? Is the screen visible? Okay. So about your about controlling insulin resistance, okay, for everyone, not just for women who are suffering from PCOD, for everyone, intermittent fasting. Okay, please read about it. Intermittent fasting for PCOD and PCOS is quite helpful. Okay. To control, like to bring back your menstrual cycle to normal, and to for weight management, as well as not, if you are a person who has a risk of diabetes, like your parents are diabetic, both your parents are diabetic, your grandparents are diabetic, if you come from that kind of family tree, okay, it's ideal for one to follow intermittent fasting. It has various health benefits not just for weight management, but to train your body not to become insulin resistant. Okay, to train your body not to become insulin resistant, intermittent fasting is very helpful. Okay, for all the women who are suffering from PCOD, PCOS, it will also help once you set up on intermittent fasting. When your hormone, insulin, which is a hormone, that level comes down, it becomes normal. Automatically all the other hormonal secretions will follow back. Okay, your progesterone, estrogen, everything will follow back with insulin, and it will help you to regulate, to have a even better and a better experience of your menstrual cycle. Okay, so these are the examples of food. When it comes to glycemic index, food that have a glycemic index below 55 or below are considered as foods that have low glycemic index. Okay, in the chart which is given here, uh, adjacent to each of the example which is given, there are certain numbers. Okay, that numbers is the glycemic index here. Okay, so you can plan a menu plan or a diet, okay, for the diabetic patient based on the examples given here, with respect to the food items which have glycemic index which is less than 55. Medium, you can use medium for carbohydrate to an energy generating food, like parboiled rice, okay, whole wheat, multigrain items, okay, that will have usually a medium glycemic index. So you can plan with low as well as medium glycemic index food. Do not choose high glycemic index food in that particular area of menu planning for diabetic patient. Do not choose any food that has a high glycemic index. For example, the numbers which are equal to 70 or more, don't go for that items in a diabetic patient's diet. Okay, for example, whole wheat bread, white bread, watermelon. Okay, these are the examples of some high glycemic index food. Don't go for these items in a diet. Medium and low glycemic index food is ideal to plan an entire day's menu plan. Okay, then the fruits also, because soluble fibers are very necessary for diabetic patients, but there are some free sugars which is already present in the fruit. Okay, so the fruit which has the least amount of free sugars, that's the kind of fruits which you have to give to a diabetic patient. Okay, for example, custard apple and all, it has high amount of free sugars as compared to amla or any forms of berries like strawberries, blueberries. They have very less amount of free sugars. Okay, banana has high free sugars, custard apple, watermelon. Okay, these items have a lot of free sugar, so that has to be avoided when you're giving, when we say fresh fruits and vegetables has to be given to diabetic patient. Which kind is important? So you can take a screenshot of this particular slide. Okay, various fruits and vegetables available in India, the number of free sugars, corresponding free sugars and carbohydrates, and the glycemic index value is given here. So the ones which have very low glycemic index, very less amount of free sugars and glycemic load, that kind of fruits, 2 cups or 1 cups, you can give them during the brunch or after lunch. You can plan a diet with this. All these measurements is based on, you can see a line written at the end of this chart, 1 medium fruit or 1 cup of this particular fruit serving, that has this many amount of carbohydrates and free sugars. Okay, medium sized fruit, or at least 1 cup of a sliced or diced fruit. Then coming to the physical activity, avoid any physical activity, any high intensity, low intensity, or moderate intensity exercises if a diabetic patient is in a stage of hyperglycemia or hypoglycemia. Or hypoglycemia, it has to be avoided. Do not encourage a person who is currently, as of now, when you do a RBS, random blood sugar test, if it shows hyperglycemia or hypoglycemia, do not encourage them to have any moderate intensity, low intensity, or high intensity exercise that particular day. Okay, and you can suggest them to have 150 minutes of moderate intensity exercise per week. That's the ideal rate. And exercise right before having a meal or shortly after. Shortly after means 20 to 30 minutes after having a meal, we can exercise, or just before having a meal. That's the ideal time. Moderate intensity aerobic exercise are suggested here, like cycling, swimming, brisk walking, okay, or fast walking, gardening. Okay, these things are moderate intensity exercises. It's suggested for 150 minutes per week. Then coming to complications of diabetic mellitus, like when if it is not treated or if a dietary management is not done, patient can go into a state of hypoglycemia. Hypoglycemia is a very emergency condition. Okay, immediate emergency medical attention has to be given when a person goes into the state of hypoglycemia, because it can lead to immediate death. Okay, so hypoglycemia is a complication to it. So as I said earlier, the signs and symptoms for hypoglycemia, you will have um, some palpitations, tremor, like nausea, dizziness. Okay, these symptoms will be there for hypoglycemia. Ketoacidosis, body, since if it is an unmanaged diabetic mellitus, overall circulation will be acidic. Okay, the body goes into the state of ketoacidosis. The first will go into the state of acidosis, then it will go into the state of ketoacidosis. The circulation, the body will not be alkaline wherever it is necessary. Body will be very much acidic. Blood will be acidic. There will be too much of uric acid in the blood. Okay, so that is a state of ketoacidosis. And also along with that, too much of ketone bodies will be secreted in the urine. Then infections, even if they have a small cut or wound, if they're diabetic, wound healing will be very much delayed. And if there is a delayed wound healing, if it's a open wound along with delayed wound healing, there are high chances of that wound getting infected. Okay, so that's how they are at the risk of developing various infections just with a small cut or tear on their body. Then cataract and retinopathy, too much of blood sugar glucose level, it will damage your nerve synapses as well as the structure of your neurons. Okay, that's how you develop various neurological issues like paresthesia, twinkling of your extremities. Okay, loss of sensation, numbness of the extremities. Okay, that's the kind of state you go into in final stages of diabetic mellitus, where usually when a person does a random blood sugar test, when their blood glucose levels are more than 350, nearing 400, Okay, these are very serious cases of diabetic mellitus, and in these cases, usually you will see they will complain with a numbness or tingling sensation of their palms, feet, extremities. Okay, so it is associated with retinopathy also, because here the neurons are affected, the neurons of your eyes are affected. Then heart disease, it goes hand in hand. Increased blood sugar level, it will affect have a increased cardiac output, and prolonged cardiac distress will lead to any cardiovascular disorders. And along with that, if it's since it's a lifestyle diseases, okay, people who are obese, who are at risk of getting cardiac disease as well as diabetes. Okay, any of these condition can come first. They may contract diabetes first, and later they may contract cardiac diseases. Okay, it can be vice versa. First cardiovascular diseases, which leads to diabetes. Okay, with respect to this diabetes being called lifestyle diseases, risk of cardiovascular diseases comes along with it. Okay, a diabetic ulcer, especially when there is a small cut or wound which took place on their feet. Okay, they have to be very careful about the feet, because neuropathy starts with numbness and loss of sensation of the feet, and any wounds on the feet, if it is turning yellow and white, it is if a wound is not turning pink as soon as possible. If the wound is turning pink, means it is healing. But if the wound is not turning pink, it is turning into pale white, yellow, and then you see dark spots on the wound, it means necrosis has started. Okay, that's what we call it as a diabetic ulcer. Okay. For all the people who are having a sedentary lifestyle, okay, all the people who are sedentary lifestyle, obese, lean, or whatever their BMI is, if they are under a sedentary lifestyle, it's ideal to keep the calorie intake between 20 to 25 kilocalories per kg body weight. Then nephropathy, since the kidneys will be on a high alert duty to tackle the excess blood sugar level, okay, slowly the kidney tissues, the nephrons will degenerate, and that will lead to some nephropathy or any pathological diseases associated with the kidneys. Then coming to the pregnancy, there are two types of diabetes. Okay, one is pre-gestational diabetes. Pre-gestational means related to pregnancy, the time period of that 9 months and 1 week. Okay, that's the ideal gestational time period. Okay, 42 weeks. That's the ideal gestational time period. That's what we call gestation. Okay, the time period when a woman is pregnant. Okay, from the conception to the delivery of the child. So that's gestational time period. Okay, so pre-gestational means before getting pregnant. Usually this pre-gestational diabetes, it usually goes undiagnosed. Especially that is the reason why if a couple is trying to plan for a child, the first thing nowadays the gynecologist will do is monitor the woman's blood glucose level and the urine glucose level. Okay, these things are monitored to rule out any chance of the woman being in the pre-gestational diabetes space. Okay, and most of the time what happens is that once a woman gets pregnant and then when she follows up with the blood and urine test, that's when we see the patient is diabetic, and instead of starting her treatment before pregnancy, we take her as a gestational GDM case. Okay, gestational diabetes mellitus case. So usually pre-gestational diabetes goes undiagnosed. If this person, if the woman is suffering from type 1 diabetes since her childhood, that is known. So that is a example of pre-gestational diabetes. Type 2 diabetes, if it goes undetected during her youth or during her mid 30s, then we put her into the category of gestational diabetes mellitus. Okay, and both these conditions, okay, pre-gestational and gestational, both these conditions has the risk to the child's future, which is what the child may suffer from some kind of eating disorders, or the child may be at the risk of getting childhood obesity, or type 1 diabetes. Okay, that's the risk factors when a woman is suffering from gestational diabetes mellitus or a pre-gestational diabetes. And usually both these cases, when you see the prevalence ratio, urban women are at more risk than as compared to rural women. When coming to alcohol intake, um, it's when a person is diabetic and when they take up alcohol, they consume alcohol, it has a negative effect on the liver. Okay, because this alcohol has to get metabolized in the liver, and what happens is that while alcohol is getting metabolized, it will block the liver from sending extra glucose into the bloodstream. Okay, so what happens here is the patient goes into the state of hypoglycemia. Okay, alcoholism will lead to hypoglycemia in a diabetic patient. And hypoglycemia is a very threatening condition, life threatening condition. So that's why, if possible, if a person can abstain from alcohol, that should be encouraged. Okay, it will affect the blood glucose level, for example, making the patient hypoglycemic. Okay, and like for example, the first generation diabetic drugs which we used to use, sulfonylurea. Okay, sulfonylurea is a class of drug which we used to use. It was the early generation of diabetic mellitus drug. Okay, it alcohol has a very negative interaction with that. It can make the patient's face flush out into a pink color. Okay, and again palpitations of the heart, like in case of hypoglycemia, heart palpitations that will increase. And drinking and driving should be avoided. Limit drinking wherever it is possible, and if at all, they can switch their drinks from rum, whiskey, and if they can switch them to breezers or like wines, twisters, etc., that is ideal. And if at all they want to drink, they want to enjoy a festivity or any celebration, they can ask for zero calorie drinks. Okay, zero calorie drinks is also a very good substitute for diabetic patients. But high calorie drinks has to be completely avoided because that will lead into the state of hypoglycemia for diabetic patients. Then dietary supplements to manage. Okay, apart from medications, what are other dietary supplements you can take to manage the condition? Fenugreek seeds, as I have said earlier, at least 25 grams of fenugreek seeds every day. Okay, morning, night, evening. You can divide it, powdered form, or soak it in the water overnight and then drink it, or boil the fenugreek water and drink that lukewarm water on empty stomach. And 15 minutes before you consume any meal, have this fenugreek water. It will regulate the absorption of glucose in the intestine. Then cinnamon powder or cinnamon sticks, again the same technique, you can use it, like when you are boiling your water, or if you prefer to have lukewarm water, just put a cinnamon stick in that water and keep it throughout the day and drink that water throughout the day. Okay, so that can also reduce the carbohydrate digestion. It can delay the carbohydrate digestion. That is what we are looking here. When it is simple carbohydrates or simple sugars, it will be quickly absorbed by the intestine and it will be quickly translated into the blood circulation. But when there is a complex carbohydrate or a complex sugar, okay, the absorption, the breaking down, the metabolism will take some time. So there will be a delay of absorbing this carbohydrate, converting it to glucose, and sending this glucose into the bloodstream. It will take a little bit of time. So cinnamon sticks, cinnamon powder, or cinnamon water in general, it will help in that aspect. Even having tea which just has cinnamon, that is also quite healthy for them. Green tea with cinnamon is quite healthy for them. Yes, you can take the fenugreek water or cinnamon water during pregnancy. It doesn't have any harmful effects. Okay, these are like your essential kitchen ingredients which you can take pregnant or non-pregnant. Okay, even if you're not diabetic, you can follow these tips and tricks to prevent diabetes in future. Okay, so it doesn't have these are not synthetic supplements. It doesn't have any ill effects on pregnancy. cinnamon, fenugreek, okay. Then bitter gourd or bitter melon. It is, I guess people know about this bitter gourd. Okay, it's very essential for people who suffer from diabetes. And even if you don't suffer from diabetes, if you suffer from insulin resistance only, having a bitter gourd juice, it is difficult to consume, yes, but if you have a palate for that, if you have a palate for bitter things, it's easier. Okay. Then aloe vera, dried aloe vera leaves are also available. Okay, juices are available, or you can make it at home. Aloe vera gel, edible aloe vera gel is also available in the market. But the most ideal way is to grow this plant at home and use the organic one, which you can take it from your kitchen garden. That's the best way. So having aloe vera juice is also quite good for people who are suffering from diabetes. It can control not just the blood glucose level, but if you are suffering from high cholesterol issues also, like hyperlipidemia, aloe vera can regulate the lipid levels also. Along with glucose level, it can control your lipid levels also. Then we have this gurmad leaves or gurmad powder, which is available. I don't know what we call it in other languages. Just search about it. Okay, in Hindi we call it as gurmad. The leaves. Okay, extracting the juices from the leaves or boiling the leaves in water, that can also be beneficial. And as a Ayurvedic supplement, this powder is available. Countertop, you can go and get this. Okay, you can mix it with milk, or like skim toned milk or lukewarm water, and you can drink it on empty stomach. That can also help you.